By now, most of you have probably heard about variants of concern in the media, so I thought it might be a good time to have a little chat about variants of concern, talk about why we actually care and what we can do to prevent the spread of variants of concern. So firstly, I get people asking me all the time, why should I care? What is this thing? I'm vaccinated, does it matter? So it's really important to know that viruses mutate all the time. This is not unusual, and it's to be expected when a virus is in circulation. So we're well versed in how viruses move and act. So actually the majority of this pandemic, we've been keeping track of these mutations and trying to understand how many there have been, whether they're of concern or not. Are they affecting whether it's transmissible or how severe disease might be? And we've been keeping up with that, and some of these pop up as variants of concern because it's possible that the way that they move and act might mean that maybe our vaccines aren't quite as effective, or it's highly transmissible, or that it might cause severe disease. So that's why we care. If you're vaccinated, it's really important to know that you can still get coronavirus. And the way that these viruses act is that if you give them more opportunity to multiply, then when there's more of it, it gives it more opportunity to mutate and develop more variants of concern. So it's a bit of a cycle there. So we want to make sure that we're stopping the spread across the board, variant or not variant, of COVID, so that it doesn't have that opportunity to spread. We ensure that our vaccines are more effective. To let you know, one of the main variants of concern that we have been talking about lately is what was formerly known as the variant that originated in India. I won't be calling it that from now on because I think that has really negative connotations for where people are from or their backgrounds, and I'll be referring to it as B1617.2. If anyone has a fancier way of saying it, let me know, but that's what we'll call it from now on. So that's the one that we're concerned about because it's possible that it's more transmissible. We've seen that it's likely more transmissible than the previous Kent variant, which is the one that's been dominant in the UK for at least since the winter time. But recent evidence has said that it doesn't cause more severe disease, especially in those who have had their first and second doses of the vaccine. The vaccines are really, really effective on this variant. So it's really important, if you've not got your vaccination yet, make sure that you book in, take up that opportunity to get your vaccine. If you happen to become positive, make sure that you're following the same self-isolation guidance. If you've got symptoms or if you've taken a lateral flow test and you're asymptomatic and you're positive, make sure that you self-isolate. And if you've had a lateral flow, get that PCR confirmation. But it's all the same. At the moment, all of our swabs of positive cases are being sequenced. And so what that means is it goes to a lab and they figure out whether it's one of the known variants of concern. And if it is, that's flagged to Public Health England, it's flagged to me and the local authority so that we know that there's a possible variant of concern and we need to take some rapid action. So rest assured that if you have a variant of concern, those who need to respond and help support you will know. If there's only one or two variants of concern in a place, we may come to you and let you know, and we may ask you to really be in a very enhanced interview way. Go back through your movements, make sure we've got every single contact we could possibly have, and ask them to self-isolate. In that way, there's not much that's different. If we can't figure out where you might have picked up that variant of concern, we might approach it differently. That's the difference in what you might have seen in the media around things like surge testing, which is effectively just lots and lots of testing in an area to try to figure out if you've got a variant and where those pockets might be. Okay, so there's nothing for you to do in advance other than make sure that you're following the guidance. Really, really important. The lockdown stages have gone so well. We've done lots of suppression of this virus, and we want to make sure that we continue to do that and we don't have to worry about variants of concern. But rest assured, if we pick up a variant of concern, we are well prepared and very ready to respond if that's the case. But for you, as the public, follow the guidance. If you become a positive case, make sure you self-isolate and wait for that phone call because we'll be in touch with you to let you know what the next steps are. Thank you.